Joining us now is child psychologist and early show contributor Dr. Jennifer Hartstein. And we should point out, this is really your area of expertise, is depression, self-injury, suicide in teens. So it's so good to have you here on this topic.
Thank you.
He's an inspiration.
Absolutely.
Sadly, for a lot of families, it doesn't work out this way. So when you're dealing with such an emotionally challenging time in your child's life, they're a teenager.
Right.
How do you know that this isn't just they're being a teen, they don't want me around, and that there's severe depression?
You have to really look for warning signs. There are some clear warning signs. Teenage depression, adult depression are different. So the teen depression, is more irritability. It's not having interest in things that they used to have interest in before. It's really a shift in the person that you knew more so. So it's to the nth degree. It's not just that typical irritability in teenagers. So you really want to tap in. And if your gut is saying, I'm worried about my kid, ask the question.
Go with your gut. Ask the question. What is the question? Are you depressed?
Hey, I'm worried about you. I'm noticing that you're not hanging out with your friends or you're in your room a lot. What's going on?
Suicide is it the third
leading cause of death amongst 15 to 24-year-olds.
Preteens and young adults.
Mm-hmm.
Signs, red flag signs here that suicide could be something that's going through their mind.
Right. There are many, but let's highlight three that really might happen. So one thing you want to be aware of is if they're making statements about not being around anymore. Are they making statements like, well, when I'm not here, you'll miss me when I'm gone? That's something, it's something you want to...
I know you say that, and I can't even imagine hearing that.
It takes your breath away, so you want to think about that. The other thing, they may start saying goodbye and giving away their prized possessions, giving their mitt to their little brother, saying goodbye to you, saying goodbye to friends. And lastly, any really acute behavior change. So if there's been this low-level depression and irritability, then all of a sudden they're excited and happy. What's going on? Have they made the decision? A lot of suicides in teenagers, though, are impulsive, so we want to be aware. That's certainly what Jordan said.
And are there different things that you need to look for if you have a daughter or a son?
Girls attempt suicide up to 3 times more than boys. Boys complete suicide up to 3 times more than girls. So the fact is, method is really the key thing. So if you notice that there's depression, you want to be aware of that. Boys choose more violent means. So we have to be careful of what they have access to.
And how you approach it. You mentioned that teen depression and adult depression are two very different things. So do you grow out of teen depression?
Most episodes of depression in teenagers last 6 to 9 months, but some definitely last longer. As Jordan highlighted, he's still dealing with it. So it's not something you grow out of, but you do want to learn how to deal with it more effectively. So you do make better choices. You do learn the coping skills that you need to survive.
And how important is it for someone like Jordan, who is sharing right now, going through this healing process, for him to do that?
It's so important for him to stay in touch with himself, what he needs, a therapist that can help him when he's really struggling, and work on all those coping skill problems.
Just it reinforces the point of how important communication is with your child, no matter how difficult it may be.
Absolutely, and how scary it might be.
Dr. Jennifer Hartstein, always good to have you with us.
Thanks so much.